peanuts, turkey, chicken, seafood, watermelon, cantaloupe, peas, soy, milk, and dairy. For most of us, these foods are commonly seen throughout our campus dining halls. However, often forget to consider that to some, these foods are highly dangerous. If my brother were to consume any of these foods, his throat would swell, cutting off his air supply, eventually choking him. This is an allergy. Most of us either have an allergy or know someone with an allergy. It's important to understand the many aspects of allergies and reactions in order to better understand how they impact the individual. I grew up in a household in which food allergies was the main focus. Every food, every snack, every drink had to be checked over and over for possible allergens. As I grew up, I took a role in ensuring that the food we eat is safe for everyone, especially my younger brother. Understanding the complex bodily function that is allergic reactions allows us to properly respond and react to them in the future. To accomplish this, it's important to understand how allergies develop, physiologically what happens in the body during a reaction, and the available treatments for allergic reactions that we currently have. The first step in understanding an allergy is understanding where they come from. So, what is an allergy? In 2001, the European Journal of Clinical Immunology and Allergy defined an allergy as a hypersensitivity reaction initiated by an immune system mechanism. So where do they come from? Well, there are two major ways in which allergies develop: heredity and hygiene. Hereditary allergies are described as atopic. This simply means that if someone in your family has an allergy, you are more likely to develop an allergy. In 2014, Allergy UK, an organization that works with the United Kingdom's Department of Health, ran a study that discovered that over half of children from atopic families will go on to develop an allergic reaction or disease in the future. The second possible way that allergies develop is the hygiene hypothesis. This is relatively new to the scientific world. The hygiene hypothesis states that in order for our immune system to be strong and fight off allergens in the future, we have to be exposed to a variety of different allergens while we're still infants. The hypothesis states that because we now live in a world where everything is clean and sanitized and antibacterial, that our immune system doesn't get that adequate exposure. This results in an immune system that doesn't have the experience nor the strength to fight off an allergic reaction in the future. So now that we know two ways in which allergies develop, we can learn physiologically what happens in the body during an allergic reaction. Now, there are two phases in which the body responds to an allergen: identify and respond. In the identify phase, an allergen is introduced to the body. The introduction can be in a variety of forms: touching a cat, inhaling pollen, eating a food. Once the body is introduced to the allergen, it is identified as friend or foe. If identified as an invader by the antibodies, the body then moves into the response stage. So the first step in responding to an allergen is the release of the immunoglobulin E, or IgE. The American Academy of Asthma, Allergy, and Immunology defined IgE in 2016 as an antibody that travels to the invading allergens and releases chemicals to fight it off. The allergen, or the chemical that it releases, known as histamines, are both toxic to the allergen and the body. So they are positive in that they fight off the allergen, however they are negative in that they cause harm to our bodies. The hives, itching, and swelling are all our body's response to the toxic chemicals released by this IgE. So the final step in understanding allergies is understanding the current available treatments. The type of treatment that you will use depends on the severity of allergies. So the most common treatment for minor allergies is a medicine known as Benadryl, or diphenhydramine hydrochloride. There are different types of Benadryl depending on the reaction: creams, pills, or liquids. Benadryl is known as an antihistamine. This means that it blocks the histamines, the chemicals produced by IgE, that hurt our bodies that result in the itching, the hives, and the swelling. The most effective treatment for more severe reactions, also known as anaphylaxis, is an epinephrine injector, or more commonly referred to as an EpiPen. The World Allergy Organization journal, published in 2008, states that the most common cause for death during an allergic reaction is respiratory compromise and cardiovascular collapse. Epinephrine, or as most of us know, adrenaline, helps prevent death by expanding the walls of the blood vessel, increasing the blood flow to the heart and lungs. Most individuals have never used an EpiPen. Today I'm going to show you the proper technique as it could possibly save a life. The steps are relatively easy to remember if you think of the acronym FPI-10. Form a fist around the injector, pull off the blue safety cap, inject into the outer thigh, and hold for 10 seconds. Following the epinephrine, medical care is required to ensure that our body and lungs return to their normal states, and the reaction is over. To conclude, an allergic reaction is a complex bodily function that is difficult to understand. By learning the fundamentals of the development, the physiological response, and the treatments for allergic reactions, each one of us is more equipped to handle them in the future. When I was in 5th grade, my brother was served a peanut butter and jelly sandwich during lunch. He quickly became short of breath and his lips swelled. The lunch attendants did not know how to use an EpiPen. At 11 years old, I was trying to use an EpiPen. I injected my brother with that day, and he was carted off to the hospital, and luckily he survived. For days afterwards, I was terrified that I had done something wrong and I had killed my brother. Perhaps if the lunch attendants knew how to properly recognize and react to this allergic reaction, my family would have been saved from this trauma.